is Bill Taranto, who is up next. Hey, Bill, good to see you.
Good to see you as well, Stan.
And Bill is also on faculty with Columbia, teaching in the digital health strategy as well as the digital health and smart investing in digital health program with his novel and unique growth strategy framework. And it's just an honor to have you here, Bill. And it's also great to have with us today Dr. Elman, the managing partner and co-founder of Esplanade Ventures. And really good to have both here today. And Bill, you take the stage.
Thank you. All right. Well, thank you very much. As Stan said, I'm Bill Taranto. I'm president of the Merck Global Health Innovation Fund, as well as chair of the HIT Lab Breakthrough Alliance. And I'm thrilled to be talking today to Dr. Sheldon Elman, who's a physician, an entrepreneur, as well as an investor. So welcome, Sheldon. Appreciate you joining us today.
Thanks, Bill. Delighted to be here.
Well, I want to start off a little bit about your journey. Esplanade Ventures is a pretty new venture firm, but what was your journey, getting you from the beginning of your career to where you are today with the beginnings of Esplanade Ventures in the last couple of years?
A topic near and dear to my heart. So number one, I'm still a practicing physician and still seeing patients actively, but over the years have created a number of companies in Canada. And I think that's been a great perspective on the value that we bring to our limited partners, our investors, and also the companies that we actually invest in, because functioning for the past 35 years in a public health system like Canada is, and being able so close to the US and understanding the US market has given us a unique perspective on bringing value into this ecosystem. But so a couple of years ago, sold one of my founding companies where I had 800 employees, 50 offices doing executive health and wellness and corporate medicine, and decided to get into both the private equity space about 13 years ago, and 2 years ago, as you just pointed out, Esplanade came into being as a really new venture cap fund, really to capture the value and the craziness that's happening in digital health. And this was before the word COVID came in, all right? And COVID, as the last speaker just mentioned, has just transformed everything, accelerated things, literally turbo boosted the world into unknown territory. And so we're an active player in that whole area right now.
Fantastic. So let's talk a little bit now about Esplanade Ventures. So I'd like to understand a little bit about where you invest, kind of what stage you invest in, and what are your focus areas as a fund?
So as compared to many super successful funds that are focusing on issues with respect to revenue cycle management and EMRs and hospital-based systems, we focus on one thing and one thing only. It's really the consumer-driven approach to healthcare, right? And that's been literally a shift as well by, one cell phone now enables, as one of the last speakers showed, that's changing the paradigm, all right? And so everything that we're doing right now is saying, how do you and me and our family members and all the people in the audience, how can we really benefit ourselves from this shift to brand new technologies, software, and digital innovations? How can we really benefit going forward? And that's really been our unique focus on that. And if it works for us, then we'll really take a serious look at it. And just as a great little vignette here, despite the fact that we're a little bit less than 2 years old as Esplanade Ventures as a fund, we've looked at over 800 companies and invested in 12 already, and only 12 out of 800. But like, it's just imploding there, where people just coming at you and stuff like that. It's been wild, absolutely wild.
Fantastic. Can you tell me a little about your portfolio? Like you mentioned, you've done, which is pretty remarkable in just a short period of time, that many investments. And I'm just curious if you could talk a little bit about some of the investments you made and why you made them and where they're focused at this time.
That's great. So we've invested in 4 companies in Israel, 4 in Canada, and 4 in the United States. And we try and develop a sort of a synergy between sort of the investment thesis that each of them can potentially help the other. And in fact, that's happened, you know, on a number of occasions. And because my team is seasoned entrepreneurs and professionals, healthcare folks that whose own money is on the line, very similar to other of the successful venture cap funds. We get sort of, as they say, down and dirty in a way, and get onto the board and really become an integral part of the because they're early stage. Seed and A round, and we really can make an impact on them as to what's their go-to-market strategy, how do they approach regulation. Even some of the companies within Canada or Israel that we're on the board of, how do we get them into North America and vice versa? And we're not typically, we're much more global focused, and as compared to some of the great speakers on preceding this morning, we're looking really not just at the U.S. market, we're looking at a global initiative.
How do you think about scaling these? Because, you know, one of the hardest things that I found in my career is, you know, how you scale a digital health company. And I'm just curious to where do you think maybe some of the stumbling blocks, is it from a clinician adoption? Is it from a consumer adoption? Is it from whoever the payer is? You know, how do you think about, as being a global investor, think about, you know, scaling of these kind of assets?
So that's actually the one of the keys to success so far is to really understand, number one, are the people that we're investing in is really not technology. We're really investing in people, okay? And do they understand, you know, what's the approach to their customers, right? And are they willing to scale? Are they really happy to just be in their local markets? And so those are some of the sort of the attributes that we're looking for. And then by virtue of that, we've taken and helped, I'm on the board of a number of these companies as to how do we then take them into the US and scale. And we've done that. And I'm proud to say that two of our portfolio companies, I won't mention which ones, but where we invested at a very, very low, you know, like really reasonable, despite the fact numbers are going up, as you well know, okay, because there's so much money coming at it, at a sort of great value, are now well on their way to become unicorns, both US dollars, Canadian dollars, whatever dollars. It's, you know, that's an awful lot of money. So we're very fortunate in, and the other thing, Bill, because a lot of the money in the fund is coming from our own partners, et cetera, we protect our money and our LPs money, our investors' money, you know, very sacrosanct, and all our investors are actually helping. That's part of the prerequisite for people coming into our fund. They really have to help drive the ecosystem as well.
Fantastic. You know, one of the things I want to kind of touch a bit upon is, as the pandemic has kind of, you know, forced everybody into a different way of working, one of the things I think it's done is exposed more broadly what's happening in healthcare, where we start to see care gaps, where there's lack of access to care. We see interoperability issues. You know, we're seeing supply chain issues. We see slower adoption in some areas. And I'm curious how you're thinking about, you know, these issues within healthcare, which I think just the pandemic exposed. They've always been there. And then what are some of the things that you're thinking about as an investor, you know, how you maybe might be tackling some of those type of issues that we're facing?
And it's so important, obviously, because there's so many opportunities right now. What we're really looking at is how do you democratize or make the technologies available to a lot of people, et cetera. We're not as focused on how do you make money initially. It's a question of how do you provide value, and in the end, if the individual can benefit, their family members can benefit. We know that there's a runway ahead of us of people actually willing to pay for it, or somebody will pay in and help them. And it's proven out a number of times in our portfolio. And once we do that, then sort of the opportunities then present themselves for other investors coming in. We've been quite successful at that.
Good. When you think about a little bit about what you're investing in. And for the investors who are out there and the entrepreneurs, and as you're looking at the market, what kind of excites you these days as an investor that might not be the typical area that people are looking at? Perhaps, everybody's looking at telemedicine. Is there anything that's new and exciting that you might find interesting that the entrepreneurs and investors in the audience might like to hear about?
So, a couple of companies. One is based in Israel called Bina. Just by using your cell phone, looking at a video of yourself, you can do your heart rate, your respiratory rate, your oxygen level, your mental stress level, and no sensors and no wearable devices. Although that is part of the ongoing equation, and that's been transformative. So how does somebody in Africa be able to use their cell phone, all right, in order to then say, hey, I can now have the power of vital signs measurements in my hands, and how is that going to affect me? Do I have to run to the hospital if my respiratory rate is bad or my O2 saturation is low? And how can we input this to a telemedicine provider? So these get me super, super excited. I'm a little bit of a techno dweeb, okay, kind of deal. But again, if it feels right. And the other component is taking risk in all of this, because some of these are early stage companies, all right, and so really understanding, is there a significant value proposition for a consumer? How do we then surround the entrepreneurs with the right kind of ecosystem and infrastructure, and then take them into the stratosphere?
Great. When you look at technologies, I'm curious, do you look at it a little bit more agnostically towards therapeutic areas, or do you tend to focus on certain therapeutic areas that might not have the type of services? For example, I do know in oncology, we don't see a lot of, post-patient care solutions. Typically the patient goes in, they get diagnosed, they get their chemo, and then they're triaged back to the primary care physician. But it seems to be a space that doesn't maybe have a lot of tools that are available to them. But in diabetes, we see a lot of tools available to those types of patients. So I'm curious how you think of therapeutic areas with the way you look at investments.
So it's probably more opportunistic, all right, we're really not focused on mental health or wellness or whatever. We're really trying to look at an individual as a holistic sort of entity, and it's not HOL, it's WHOL, like the whole individual. And I guess being a family physician, I look at people not as one system, not cardiology or renal or whatever. It's really multifaceted. And one of our other companies called Carebook, carebook.com, has gone from literally 20,000 users 18 months ago to 3.5 million. All right now, and it's a wellness approach to individual managing their health and their family's health, and so it's been that's where we're looking at, is how do we drive synergies for the consumer-centric driven approach.
Great. One of the interesting things that you and I had a chance to speak that kind of piqued my interest, because it's very similar in a sense to what we do, and maybe not as formally, but or maybe it is. And I want to get into it a bit about, you mentioned that you also have a private equity firm that you work with. And I was just curious, where does the interplay between the private equity firm and then your venture capital firm come in? Do you see the private equity as a tool in the toolbox to bring that scale or greater investment, or do they not kind of play together? I'm just curious, because we have a private equity firm that is actually there to promote bigger scaling of those smaller assets.
For sure, it's sort of like the feeder organization, Bill, as you and I talked about. So, and as if you're into tech, you like speed. You like, I mean, from the days of when I worked in the emergency room, it's like rapid fire access and stuff like that. Private equity is watching grass grow, and you have to, you have to be there for the next number of years to create that value. The digital world and venture cap is like literally overnight, and it's turbo boosted. So, but we know that the virtual space can feed into our private equity sort of channel, and vice versa. And we use both arms to be able to drive opportunities in that regard. And it's sort of, and driving, if I may digress for 1 second, and I'm super honored and thank both you and Stan that I'm now the newest member of the Breakthrough Alliance board. And this is this is a fantastic service that you folks are, and now all of us are doing, to providing to many and many of the people on this call. And I think that this is amazing because there's so many things. I mean, it's like, which television set or which computer or which cell phone are you going to buy? There's like 100 different models out there. And by having sessions like this and the networking and just sort of breaking things down into bite-sized chewies, I think our job, okay, as board members is to be able to give that sort of, interpretation of what's out there, what's good, what's bad, and stuff like that. You and I have been in the game for many, many years, and we've seen the good, the bad, and the ugly. So it's a question of, doing that. So, delighted to be on board on that. And we're providing this as a great service to all the members of HIT Lab and Breakthrough Alliance.
Fantastic. Yeah, that was going to be one of my questions. So you beat me to the punches. Why your interest in the Breakthrough Alliance, and I agree, it offers such a wonderful opportunity for different parts of the ecosystem, and we do welcome you. One other interesting question I have for you about where technology goes and where digital health goes in the future. When I started the Merck Fund 10 years ago, monitoring was kind of in its infancy, and today it's very ubiquitous. You have cardiac monitoring, you have diabetes monitoring, you can monitor almost everything, and the devices have gotten smaller, faster. The technology is unbelievable. What sort of technology do you think today is sort of in that infancy that you might see really form where digital health is going in the future, much like monitoring is today?
I think that your question is so appropriate, Bill, but I think it's not as much the technology as the AI that will be behind all of these different technologies. Okay, because and coming from the sort of being the sort of my medical background, being as a physician, doctors are terrible to accept change. Like, I mean, we're really not like change friendly kind of deal. And 2 years ago, if you said well, you're going to practice telemedicine, there was a very, or talk to the general public, you're going to use telemedicine. People say, what are you talking about? I'm not going to do it. 11% of the population was going to do it. Now 75% says, okay, let's go again. And the physicians are ready to do this. But again, the driver is to how do we take this massive influx of data, okay, coming from the wearable devices and coming from the platforms and stuff like that, and interpret them in a way that helps people understand their health much more effectively, and the healthcare professionals to interpret that more effectively. And I think that we look for those nuggets as to how then can we then put AI into each one of our portfolio companies eventually, and that's where the secret sauce will be.
No, I agree. I mean, we've always had this phrase that data is the currency we're going to use to transact in the future healthcare market. But the problem was what was going to release that currency, so to speak. And I think you're right. I agree with you that the AI component is, I think, the backbone of what will turn that data into a much better currency within healthcare. I know we have about a minute left before Stan will jump back on. And we only had about 20 minutes today. But is there anything you want to leave the audience with? Any parting thoughts about, whether it's from being an investor, an entrepreneur, or any message that you'd just like to leave the audience with that might help them the way they think about digital health?
Probably embrace change, number one, whether you like it or not. COVID, and I agree with many of the people on before this, was that COVID has changed the world, and we're not going back to the way we were. Despite the fact that we'd all have this wish fulfillment that we would be going back. But so embrace the change and figure out how to use all of these new devices like Star Trek and and say, how are we going to use this to better society, better our own health, and do it in a cost-effective fashion, and democratize healthcare, all right, and create that value for people. So that's really what So welcome on board.
Fantastic. Well, thank you, Dr. Elman. And I'll put in one last plug for the Breakthrough Alliance because I am the chair, so I feel obligated to do so because I want to. But if you're not a member, please join. I think you'll find that the Breakthrough Alliance is just invaluable as an ecosystem builder for your company. Thank you.
Thank you very much, Bill and Sheldon, for a great 15, 20 minutes here today. And Again, as Bill said, Sheldon, welcome to the Breakthrough Alliance and joining the board there. And Bill, thank you for the, again, the absolutely kind words and for chairing the board. Literally the Frank Sinatra of digital health. He is the chair of the board for the next few years and overseeing this, this tremendous alliance of organizations.